Hello.
Hello, Cikomola. Am I pronouncing
Yes.
your name correct?
Yes. And
Yes.
and I'm sorry with the technical problem. I don't
Understood.
know what happened with the link, but now I'm okay.
Thanks for joining. And we are live right now. And if you are fine, we can start.
Yes. Yes.
Okay. So, welcome once again to all the viewers. And this is another exciting episode of the Metabolic Health Conference, where we explore various health topics that impact and transform our lives for the better. I'm your host, certified nutritionist, and today we have a special guest with us, Professor Dr. Cikomola Cirhuza, a renowned expert in the field of endocrinology and diabetes. Welcome once again, Doctor.
Thank you very much.
So, I would like to provide a brief introduction about you. So, Professor Dr. Cikomola is an internist, and diabetes and endocrinologist practicing at Bukavu University Hospital, Democratic Republic of Congo. His main research topics include epidemiology of diabetes and metabolic diseases. He has particular interest in diabetes remission and obesity management. Doctor, please tell us about your journey into low carb and your studies on diabetes, any personal success stories which drew you towards low carb as a therapy or a solution for type 2 diabetes.
Thank you. Thank you very much for having me in this session. First, I have just to present a quick history of how I came into low carb. When I was studying my endocrinology, that time there is a new medicine that arrived in the field of diabetology. It was the incretin medicine, like Ozempic now. I was very happy to receive this as uh, we could be able to see people was losing weight, and then we was expecting to observe a good control with this medicine. But I was very disappointed with, because I still at that time seeing people not having a good control of their diabetes. And then I remember I used to treat the women who are developing diabetes during the pregnancy by low carb. I used to tell them to not eating very high concentrated foods in sugar. And then with this, I was thinking about how we can be able to put people into remission without having medicine, as I saw it in women who are in pregnant. And then in my practice, I met someone, Dr. Kavan, who wrote a very beautiful book, Reverse Your Diabetes. I read his book, and from that I start proposing low carb for my patients. I have many patients who, with this method, have been able to drop down all medicine. I have even a woman who was looking for baby. She was obese with diabetes. With low carb, I put her into remission without medicine. She lose many weight kilograms, and she has been able to have a baby. This is I'm very happy with this history. I have another one who was for many years on insulin. He was obese as well, and then I proposed him low carb, and now he is never using, and he's under control without any medicine now. So this is a quick history of low carb, what I'm using in Congo. But what I have to say, it is, as I know how much having medicine in Congo is very, very expensive for patients. Diabetes cure is very, very expensive for patients. I think low carb, it is a very good opportunity for diabetes in Africa. Thank you.
It's really a breath of fresh air. Whoever is listening, that whoever is suffering from diabetes, this success story is going to really inspire a lot of people to consider at least low carb way of eating as a method to deal with the type 2 diabetes and put it into remission. Thanks for sharing
Yes.
the story. And you have published a lot of research papers. For viewers, whoever is looking for the research papers are available in ResearchGate portal. So coming to your research paper on the prevalence of diabetes, particularly in DRC, Democratic Republic of Congo, and overall Africa, is there any difference that you find between the diabetes prevalence and causage? And I'm going to link one more aspect, which generally is in the discussion when we talk about diabetes. It is depending on genetics. Can you please throw light on that?
Yes, thank you. During my PhD, I was looking for the link between type 2 diabetes and genetic traits in Africa. First, I have to say that we can see some difference between the clinical future of diabetes in Africa and in comparison of what I saw in Europe. We have a kind of diabetes which is very common in Africa, called the ketosis-prone type 2 diabetes, which is very, very, I didn't see it in Europe. This kind of type 2 diabetes it's look like a type 1, where when people are having acute complication, and after this acute complication, it is like a type 2 diabetes. And these people can be put into remission. They can have several years without taking medicine with a good control. This is the first difference. The second one, it is diabetes in Africa. Type 2 diabetes occur very early in people. Around they are developing diabetes around 30 years. That's the difference I can see between type 2 diabetes in Africa and Europe. But talking about genetic, I try to look on what could be the link between some genetic traits located in Africa and diabetes. I couldn't be able to find a link between this and diabetes. The one I worked on, it was the 4 protein. It is a kind of hemochromatosis that is common in Africa, but I didn't find the link between this and type 2 diabetes. There is another colleague in South Africa who look on the traits of characterize of genetic traits in Europe. He looked on this in Africa. He didn't found this the link the genetic traits found in Europe, and in Africa I didn't found them. So what I'm telling it is, what we are seeing is that diabetes is more common in town than in village in Africa, and this may bring me to conclude that diabetes, it is more a lifestyle problem than a genetic problem, as people living in town in Africa adopted a new way of living. I'm talking about westernization of lifestyle in Africa, and I think this is the big risk factor to develop type 2 diabetes in Africa more than genetic trait.
Got it. So when you say it is a lifestyle disease, so I believe what you are also saying this is, and also when you said whatever right now you shared with us, that a proper way of eating can actually put it in remission. So actually, it is in our control whether we want to be diabetic or not. Is it so? Is that what you are saying?
Yes, I'm saying that if we can be able to bring people to know how to choose their food, we can be able to put them into remission. And this, I'm saying it with my patient. Also, I say that in Africa, diabetes is very common in towns and in villages, and this is clear because we have some study that compare diabetes in towns and in village is very common in town and in village. And we know that people living in big cities in Africa have adopted a new alimentation. They are eating processed food. As I can give just an example in Kinshasa, foods that people are eating in Kinshasa are coming from Brazil, from USA, from Europe. And that's why we have a very, very high prevalence of diabetes in Africa. So I think if we can be able to teach, to bring people to eating very well, we can be able to put diabetes into remission.
So now the next question is, when we talked about there is no clear, according to your research and whatever studies that you have referred and done, there is no clear-cut association between genetics and diabetes, type 2 diabetes. And also it can be easily addressed with proper eating, and that too a low-carb method of eating. Now, I would like to touch upon what are the top 3 things that people can do to prevent or reverse, or we can say remiss diabetes through low carb nutrition. And what are the key? What can you please share that?
Yes, I have just to give a precision. I think they could be a genetic predisposition. I didn't find it, but I think the more risk factors it is the lifestyle. And then talking about low carb. Now, if I look at what we have been eating in Africa and exactly in the Great Lake region, I'm talking about Rwanda, Burundi, the eastern part of Congo, and Kenya, and I can focus on Maasai population. We know that this population have the very low prevalence of type 2 diabetes, of cholesterol, and hypertension.
I'm sorry. I'm sorry to interrupt. Maasai population, is it?
Yes.
Sorry. Yeah, please continue. Yeah.
We know that they have the very low prevalence of type 2 diabetes, of cholesterol, high cholesterol, and also hypertension. But they used to eat steak and also milk. This is the traditional food for this population, and this is the traditional food for the Great Lake population. I'm talking about Rwanda, Burundi, and South Kivu. So I think if we can be able to bring these people to what they have been eating one century ago, we can be able to put them into remission. And even in Kinshasa, we can people used to eat what they call kwanga. Kwanga, it is a kind of bread, but that has been made from cassava, and this have not use through any transformation. We can find in this many fibers and the glycemia index is very low for this. That way, I think if we can be able to bring people to eat what they have been, I mean, 1 century ago, what this population have been eating, we can be able to put that type 2 diabetes in remission.
Okay, so the three things which I understood is remove or as much as possible cut down or eliminate processed food.
Yes.
And stick to how people ate 100 years ago before processed food came.
Yeah. Before this processed food came, that I was saying, I gave the example of Masai. They used to eat steak and milk, and even many people in Africa region. Here in Kinshasa, in Western Africa, I mean Central Africa, Western, we have some fishes, also some animals like antelope and many other animals. So I think if we remove from our diet processed food that I know are very high in carbohydrates, we can be able to control type 2 diabetes. If we remove the high carbohydrate in our food, we can be able to control type 2 diabetes and put it into remission.
Okay. And I'm not sure about how it is perceived in Africa, but overall, people have a tendency to, when I say low carb diet, when you say low carb diet, how is the adoption there? Because people would like to hear from you whether low carb way of eating or low carb diet or ketogenic diet even is a fat diet, because that opinion also is there. So what is your can you please throw some light on that?
Yes. I'm trying to not talking to patients about ketogenic diet to tell that name, because sometimes with the media they can have some information that are not correct about this. I'm just telling them to try to eat naturally. I'm trying to put them to eat naturally, and I know that this is a low carb. Naturally, we are eating low carb, fish, steak, and vegetables. Naturally, they are low carb. Even if uh, I can try to talk about cereals and even the natural cereals, they are low carb because they have an index glycemic index which is very low in comparison to the transformed food. So what I'm talking to patients to try to let them find the natural food, and they will be in low carb as natural food. Most of them they are low in carbohydrates.
Understood. And there are many in our audience who will be parents, and also now it is we are seeing uh, a lot of diabetes, if not diabetes in children, if not diabetes, some metabolic disorders in children. And
Yeah.
what are some of the key things that they could do for children? Because usually there is a perception that children can eat anything. They can eat carbohydrates. They can take a little bit more carbohydrates. That I'm not sure about. This is a kind of an Indian context of questioning, but I'm not sure about how it is in Congo. But this is a question which comes up in a larger extent. So for children, And yeah, how do we?
Yes, yeah, it is exactly the same. And I have just to present that in normally for parents, sometimes having a, a child who is obese, it's in the population, it's a good. I mean, it's like I have money and my child have to be obese. That I'm observing. And in that sense, trying to explain to parents that they have to control what their children are eating, it's sometimes very complicated. And also in the context of HIV, puts people to lose weight, even child, it's sometimes we have to take time to discussing with them, uh, to, to let them understand that they are exposing their children. And how these children are getting obese, it is because of what they are taking. Many carbohydrates in their food, many juices, many chocolate. People who are having money, they're looking for most of time food that are high in carbohydrate. And it look very nice to be obese, to have children that who is obese. And I have to manage this discussing with patient to put them to understand. I have some children that who developed type 2 diabetes around 21, 17, and I'm trying to explain to other parents that these two kids developed type 2 diabetes according to what they because of what they have been eating, and then I'm using that to explain to other parents that it's very harmful to let their children eating many times high food that are high in carbohydrates.
That's really interesting because what you said is at the beginning, the parents who think that if their children is a little bit uh, uh, bulky, it is a sign of prosperity. You linked money,
Yes,
the mentality. That's where really
exactly.
you're
Yeah.
trying to educate people on that aspect. Understood.
Yes.
Really
Yeah.
very interesting point, and it's going to be really useful for the listeners as well.
Fine.
And
So
Yeah.
Prasanna, so I will have to the live stream will end by 8:45. So we'll have to really close the session now. So Dr. Cikomola, thank you very much for joining us and sharing your wisdom for Congo. And we so appreciate. And